Other things that we heard a lot about were peptides. Oh
Oh
boy.
boy.
Did we hear a lot about peptides? And we saw an exhibit hall full of peptides, every
Hmm.
peptide imaginable.
Hmm.
So I heard one lecture where it was a PhD speaking. Then he was talking about liposomally encapsulating peptides and how that could really be a game changer in terms of it's hard to deliver these things through the GI tract because of their size, because they tend to get broken down very quickly. They're not very stable. But, he kind of talked about the pros and cons, like, of IV and being able to take them orally at home, which obviously has certain benefits just in terms of, cost and time and all of those things. But it was an interesting lecture. They talk about a lot of the peptides we talk about in dermatology.
Hmm.
Copper GHK, the
Oh
first
my gosh.
peptide ever put into a cream. And
Yeah.
every booth we went to, it was like, talking about that particular peptide for skin and hair and all the things that we do topically with it. So I thought that was really interesting. Some of the others, the BP 157, we saw a lot of that, which is one that modulates growth hormones, growth factors, is a repairing, it's kind of like promotes angiogenesis. So there was a lot of talk about peptides. They're alive and well in this whole longevity space. I think maybe we got to wait for the science to catch up, Ted, because we kept kind of waiting for the
Hmm.
big aha moment. And I
Hmm.
don't think we got the aha moment, but still there's a lot of enthusiasm. And there are lots of people using these in their patients and
I know.
recommending them.
This
And,
is.
you look at social media, they're stacking these. I'm taking this one. I'm taking that one. I can't even remember the names of them. You and I keep going, what's that BP?
Yeah.
BP?
I know there needs to be a better PR agent because these names are ridiculous. But
They do.
yeah, I think I,
Keep,
it's so difficult with the peptides because you want more data, but they're essentially generics, right? So you're not going to, it's not like one company can make them and just have
yeah,
ownership of that one peptide. So
no,
it's really,
everybody's making them.
everybody's making them. So it's really difficult to get, really large randomized trials that we would need to feel super comfortable with them. And because everybody's making them, that also raises the question of formulation and production, and are they
Exactly.
contaminated? And oh gosh, I mean, there's so much, on podium, they were touting the benefits and this patient did this and that patient did that. I use it all the time. And these are these crazy busy longevity docs who, see tons of patients and are using them.
Right.
And I'm not saying they're being unsafe. I just think for myself, I just would love to see more data, but I'm not sure we're ever going to get more data. So that's the whole crux of longevity, unfortunately.